Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. I'm super excited to be here today with two special guests. This is the first time that I've ever had a 2-for-1. We have two doctors, Dr. Aditya Verma and Dr. Amanda Price, who are PM&R doctors. So I'm just going to have them each tell me a little bit about yourselves. I will start with Dr. Verma.
Well, yeah. Hi, my name is Aditya Verma. I was born in Canada and kind of lived all over. For med school, I went to Midwestern University's Arizona College of Osteopathic Medicine, ASCOM. Did that from 2009 to 2013. And during that, I decided that PM&R was for me. And so I did my residency at University of Arkansas, Little Rock. And then since then, I've been working in Parsons, Kansas, and a little bit in Joplin, Missouri, doing mainly outpatient work, but as needed is inpatient stuff as well.
Awesome. And Dr. Price, tell me a little bit about yourself.
Well, I'm originally from very rural Oklahoma. I went to undergrad at Hampton University, and then I matriculated into Boston University School of Medicine via an early medical school selection program. And I also did my residency in physical medicine and rehabilitation at UAMS in Little Rock. And now I'm practicing in a hospital-employed private practice in Joplin, Missouri.
Yay! Small connections. Just so you guys know, you may have heard the special shout outs to Hampton University and Boston University. Amanda and I went to school together way back when.
Yes, I am familiar with Dr. DeRowan.
All right, we won't talk anymore about it because this is an episode full of secrets. But moving on to more important things that the students care about, I want to ask each of you to tell me what made you choose the specialty of physiatry.
Well, I was really drawn to the specialty because I've always liked anatomy and the overlap with neurology and neurologic disorders and then musculoskeletal conditions. And so I went to med school. I didn't even know what physical med and rehab was. And then one of our close friends, Sierra, said that there was a panel. And so I went to it and I was like, oh my gosh, this is exactly what I want to do. And I shadowed, I think that following year when I could actually, or maybe later in the year. And I really, really loved it. I just clicked. So that's pretty much why I chose it.
Awesome. And what about you?
So for me, my end was the DO school. Doing a lot more with musculoskeletal medicine and seeing the physical movement of people and how it can get affected by disease processes. And I told on my rotation some of my preceptors, I was really into OMM, but I don't know if it's for me. And they said you should look into PM&R because it's another route. Unfortunately, at my med school, we didn't get to do elective rotations till fourth year. So it was kind of a gamble to take some audition rotations for it, but I fell in love with it. I actually did happen to rotate at University of Arkansas before I went. And I got to see kind of the full gamut, outpatient, inpatient nerve conductions. It is a very diverse field as to what you can practice. And I was intrigued and enthralled by all of it.
You mentioned audition rotations, and I know that a lot of students pick those to figure out, of course, where they want to be and see themselves going through residency. In a time like 2020, it may be a little more difficult to get out there into different rotations, but what would you say that you noticed most from doing those types of rotations?
You kind of notice the things that you like and the things that you don't like, because even though we like our fields of medicine, there's things that are less favorable. And so it helps you figure things out like that. And then it can show you how a residency's culture varies from spot to spot. And that's a big thing as well. You've got your specialty, and then where do you want to do that specialty? Because it's not just learning the skills to be effective in whatever field you go. It's how many years? 3 to 7 years.
Yes.
With this group and with this environment that might not be conducive to your well-being or to how you do things.
Mm-hmm. Yeah, I did a few rotations as well, and I will agree with that. You can really determine if you click with the residents and the attendings and if it's going to be the right learning environment for you. And then on a more superficial level, just if you like the city and what it has to offer.
You bring up a good point, because I think what both of you guys are saying is you pick your field and you figure out what is important to you, what you want to continue learning and do for the next, hopefully 30 years. And you're going to get that education in any residency program because there's standardization of what you need to learn for boards and for patient care. But choosing a residency is a little different from choosing a medical school, as in you're going to be fully immersed in doing 24-hour calls and being around these people in this particular city for, like you said, 3 to 7 years. So it's important to not only take in the educational factors, but also the lifestyle things that you'll be living with.
Mm-hmm.
PM&R is a diverse field. What options are there for people to pursue in the field?
Well, you don't necessarily have to do a fellowship to kind of see a wide range of things in physiatry. So a little bit about what physical med and rehab doctors do. We basically try to help improve the function of patients that have had things happen to them that are pretty traumatic, like a traumatic brain injury, spinal cord injury, stroke. Children that are born with cerebral palsy or spina bifida, we work really closely with therapy teams to kind of help maximize their functional status. And then kind of the general musculoskeletal conditions, so sports injuries, non-surgical spinal conditions like cervical stenosis, lumbar stenosis. We work with patients and, of course, therapists to try to help them. So,
yeah, it's just how diverse the field
yeah,
is.
sorry. So ultimately, there are several fellowships that you can go into within PM&R. Pediatrics.
Yeah.
You can do a spinal cord injury fellowship, brain injury. You can do pain or sports medicine fellowship. Sometimes those are combined.
Mm-hmm.
And you can also do neuromuscular fellowships and
cancer
rehab.
Burn rehab. They get more and more subspecialized. Even now through the sports medicine route, you can do performing arts and dance medicine. Actually, NYU has a good fellowship.
Wow. It's
all tied together by how the body's ability to function is affected by disease processes. Mm-hmm. So things like, just having a crick in the neck, that's something the PM&R doc has a little extra in their toolkit compared to someone that's not specialized in approaching it. You usually think, throw some anti-inflammatories in it, but you can see if there's something neurologic going on, how to ascertain that and see about getting the patient getting back to moving normal, or at least compensating for how it's affecting them.
At Med School Coach, we know that getting into medical school is hard. In fact, 60% of pre-meds who apply to a medical school don't even get accepted. And if you want to get accepted into a top medical school, it's even harder. That's why more students than ever are turning to MCAT tutoring by Med School Coach. Our tutors are all 99th percentile scorers, have been through rigorous training, and can help raise your MCAT score by 12 points or more. You need every competitive advantage you can get to get into med school, so why not get one-on-one tutoring from Med School Coach? Our expert team will create a custom program just for you and help you master MCAT content where you need the help most. You'll raise your MCAT score. We guarantee it. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach MCAT tutoring package. You can achieve your medical school dreams, and Med School Coach can help.
That makes good sense. And I think, like Amanda mentioned earlier, at our particular medical school, we didn't have as much exposure to the field. And I think that rings true in a lot of organizations and medical hospital systems. So this is a good point to kind of bring up the fact that, or kind of distinguish, when would someone refer to a PM&R specialist versus going to physical therapy or orthopedics?
For more of the issues that typically don't self-resolve, that's where you can get extra benefit. Or, like in primary care, you're dealing with everything, sending it to be taken care of fully by a physiatrist, that's not unheard of. And, it's our bread and butter. Someone's got a pain in the back, pain in the neck. There are some physiatrists that, subspecialize. So if you were to make a referral, you'd want to make sure you're not sending like ankle pain to someone that does spinal cord injury or something like that. It's something they can do, but it's just not the scope of how they're practicing. But if you think something's affecting how someone's moving and you want to make sure that all the bases are covered, referring to a physiatrist is good for that. For instance, ankle sprain. Anyone who hasn't rolled their ankle, and it goes away on its own, but really the injury to the ligaments does affect balance and sense of position. So really to truly recover from it and prevent injury, balance, exercise, and getting set up with things like PT and not, pushing it off to the wayside is important. And so utilizing that multidisciplinary approach to help with rehab and make sure that functional recovery happens is one of the hallmarks of physiatry.
Yeah, and I'll just piggyback off of that too, because we work with therapists so often, we can kind of write more specific and detailed orders for the specific injury that we're seeing the patient for as well. And I also say, I work with a group of neurosurgeons, so oftentimes, the majority of back pain is non-surgical. So if you've already, and you may, if you're a primary physician and referring out, if you don't want to do the imaging, you probably need to send to physical med first, let them do the workup and determine if this is truly surgical. And in most cases, mechanical back pain, of course, resolves on its own. So.
That makes a lot of sense. Thank you for that clarification. Speaking about all of the things that, of course, you guys do in the field, it is definitely a new world, as we've been discussing through prior episodes, for medical students to transition from the preclinical years to the clinical years. When you guys have students that are a part of your team, what do you think makes them stand out the most in terms of performing well if they want to pursue a career in physiatry?
I would say initiative, asking appropriate questions about patient-specific conditions and actually going the extra mile and reading up on something if it's not clear. I would just say, just showing a genuine interest in the field. I know that's very generic to say, but it, after a while, kind of comes across that way. So, do you have anything to add there? It's kind of...
initiative is a big thing for any rotation. If something confuses you, you can always ask for resources to learn a little more about it. Specific exam maneuvers are pretty important to PM&R, especially neuro and your musculoskeletal exams. They're very specific exams and a little different. And then just looking at the nuances and seeing, so for this patient, you might have referred to such and such, like you might have wanted to get the MRI, but this person straight up referred to neurosurgery. What was the reasoning for that? Asking questions about why certain decisions are more appropriate than others, and then also doing readings on that. Being present is always important unless you've already matched and then you're just phoning it in. And that's always understandable. Everyone, like, you can see the hope die from an attending's eyes when someone's matched. It's like, I'm in. So yeah, being genuinely present, enthused, not enthused necessarily, but asking insightful questions and showing initiative. Those are the keys.
I think that you guys summed it up pretty well, and that can be said for any rotation. Showing genuine interest, it doesn't have to necessarily be your plan to go and pursue and match into this field, but you're there for a specific amount of time, so you should be present. You should be asking questions, because even if you don't go into this field, you may see patients that need to go and be referred, or see patients in your family. So it's good to absorb as much as you can, as well as, like you said, ask reasonable questions and ask why, and don't ask questions just to ask them, but have a purpose in it. And also study up on the specific physical exam practicing that you'll need to do in the specific maneuvers. Speaking of medical school and medical students, We mentioned earlier that Amanda and I went to an allopathic medical school and Ani went to an osteopathic school. How would you say that your osteopathic training differed from allopathic school, and do you use the things that you've learned in your DO school in daily practice now?
As far as how it differs, it's pretty much just learning OMT. You have a specific class devoted to manual medicine. One thing that a lot of DO schools did, mine included, is include a lot of musculoskeletal stuff in it. So the provocative shoulder test, neck test, SI joint stuff, looking at gait analysis and knowing the specific science for common musculoskeletal symptoms. That helps. It provides a stronger base. And then one of the things that especially the DO school doctors like to say is that medical students who go out into rotations are a lot more comfortable putting their hands on. Sometimes that's not the case, especially with remote learning, but you are more familiar with, moving someone's arms as opposed to if you aren't, you're a little more hesitant because you're just not familiar. It's not anything like being scared of the patient. It's just unfamiliarity.
Mm-hmm. And I will say, because I've worked with here in town, there's a DO medical school, so there's a big difference in kind of how some of the medical students have approached certain exams. And especially with physiatry, having that hands-on experience is extremely helpful.
That's really interesting. Speaking of the reason that you're my first twofer on the show, and it sounds like you guys are in the same room, which they are, which is why you may have seen us have a few giggles here and there from our expressions. Because we're very open on the show and they can't see us, so they may be wondering, why are there random giggles? So how did you two meet?
We met when we were in residency at UAMS, and we matched in 2013 and started our residency that year. And we were friends pretty fast.
And then a lot slower.
Then we became chief residents during the end of our third year as we transitioned to fourth year and got a lot closer. And that just kind of progressed into this love story. And so now we're married and expecting our first baby.
Congratulations. So for the listeners out there, it's not always like Grey's Anatomy, but sometimes people do meet their partners in medical school or residency or in work. Speaking of work, now that you guys are married, would you ever consider working in the same facility with one another? Because it sounds like you guys mentioned that you work in separate locations now.
Facility, yes, but not the same office. That's a little too much,
It would have to be a very, I love my husband, but do we really want to get home at the end of the day and know exactly what the other was doing because they were in the same office? No. I mean, would I accept a job at Stanford if my husband was there? Of course. It'd have to be very specific circumstances, of course, but in the same hospital system, yes, but probably not down the hall from each other. That's a lot of togetherness.
Yeah.
And I'm saying this as someone who loves my husband. So.
Yeah, she's all right.
Just okay. Yeah, that makes sense. It sounds like, of course, it's a personal decision for listeners out there who may already be married and thinking about working with their partner. But some people want to have a little boundaries and a little something to talk about at dinner. Hopefully not talking about work at dinner.
At Med School Coach, we know that matching into the specialty of your choice and the residency program of your dreams has a dramatic impact on your career as a physician. And your USMLE score is the most important acceptance factor of all. That's why more students than ever are turning to Med School Coach for USMLE tutoring. Our tutors are all 260 plus scorers and have been through rigorous training. Plus, the average student who uses Med School Coach tutoring raises their score by 23 to 55 points. There is an enormous amount of material you need to know for Step 1 and Step 2, and Med School Coach can help you be smart about how to study. We'll create a custom program just for you. Then, We'll help you master USMLE concepts where you need help most. You'll raise your USMLE score. We guarantee it. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach USMLE tutoring package. You can achieve your medical school dreams, and Med School Coach can help.
And this has been so fun, you guys, talking about this very unique and special field. My last question for you guys is, what is one lesson that you've learned that sticks out in terms of medical training in reference to giving advice to both pre-medical students and medical students as they continue their journey through our profession?
I would say try your best at everything you do, but even if your best doesn't look good, you don't let that discourage you. You'll see stories of people in med school that have applied multiple times and they make it through. So, we always get told, you want to have the 4.0 like the 50,000 MCAT score. There's other qualities that matter, and you'll see people run the gamut in your med school. And then there's always the joke, the person that had the lowest rank in school, what do you call them? Doctor. So just keep that in mind. Don't get discouraged if you see any roadblocks, and keep trying your best. There's always opportunities to make up for some of the shortcomings that you perceive.
Yeah, that's really great advice. There are always going to be people that may not think that you're suitable for a specific specialty, and there may be certain reasons for that, but definitely just kind of sticking to your goals. And if you really, really love a specialty, go all out for it, try your best, show initiative, and just work hard, because that can sometimes go a long way.
I love both of those things. I think that you both hit on important goals. Like, everyone isn't going to make it on the first try, but that doesn't mean that you should stop. And you shouldn't let imposter syndrome factor into the decisions of you even trying and attempting to match into what you love, because you may be surprised. Uniqueness is important, and we're learning about diversity in medicine, not only in like gender and race and things, but also diversity of interest and diversity of talents. And they're getting rid of some things, like there is no step one score went to pass fail, and that kind of goes with what Dr. Verma said in terms of P equals MD. You all going to work hard, you work to get there, and we know that you're all phenomenal students. You were all great students to get accepted into medical school and to study so hard. So it's going to be competitive, and if you get knocked down, get back up.
And I would like to clarify for the DOs out there, our saying is
That is true. I correct myself with that in this conversation. I was just so conditioned to say that in my own medical school training.
Yeah.
Equals MD. But
and at the end of the day, if you're board certified, you're board certified. So if you there'll always be stratifications. And so even if you're the lowest rank and you have the qualifications, what's it matter? You're still marketable and you still got the skills. So
absolutely. Well, I definitely appreciate you guys joining me tonight, and I'll just give you an opportunity to say goodbye.
All right. Well, thank you so much, Rakita, for having us on. And I hope that this was helpful to someone, and maybe we sold them on physical med and rehab. It's an amazing specialty. So
if you would like to learn more about physiatry and physical medicine rehab, go to aapmr.org and you can learn more. Take care, and I hope you found this informative. And if you are considering a specialty, just know that PM&R is the only one, really. All the others can't compare.
Well, aside from family medicine and remote telemedicine work, I would agree that this is an excellent field to look into when you seriously look into the website that Dr. Verma mentioned. And for all of those listening out here, please click the subscribe button, and I'll see you again next week with another guest. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.